Realize. Yes, go ahead.
Okay. So, good morning, ladies and gentlemen. Good afternoon and good evening, depending on the time or the place you are in.
இது கேட்கறது
As we are expecting that people from around the world might join, so different time zones, and I think it's the beauty of virtual
வால்யூம்
meetings
ரெடியூஸ் பண்ணுமா ப்ளீஸ்
that we can always be
ஸ்டார்ட் ஆயிடுத்து
connected
வால்யூம் ரெடியூஸ் பண்ணுங்க
at any time. And sometime when there are not too many people, then it's a good feeling of meeting physically face to face as we used to meet in the past in a meeting room. So it's become more cozy for considering that all the important people are here, and then we can kick off. So thank you very much, all of you who have joined this, and thank you all the dignitaries who have accepted our invitation to join this a very historical moment for us today. And wish you all, my fellow Indian, a happy Independence Day, a great day for us. And we have just heard our Honorable Prime Minister early in the morning about a National Digital Health Mission. And therefore, this program become all the more important, that how this program can support the national digital health in time to come. So thank you very much, and I welcome you all once again on behalf of the Board of Quality and Accreditation Institutes Center for Accreditation and Health Care and Social Care, chaired by Professor MC Mishra. So thank you very much, and with this, I would like to invite Dr. KK Aggarwal, who is the chairman of QAI Technical Committee for drafting the telehealth accreditation standards, and he is president of CMAAO and Healthcare Foundation of India, and former national president of Indian Medical Association, and Padma Shri awardee. So with this, I would request Dr. Agrawal to give his opening remarks. Over to you, sir. Thank you.
Thank you, Dr. Rana, and respectable Dr. MC Mishra, other colleagues, and all the people who are watching this program live. We expect at least 10,000 people to watch this inaugural function in the next 48 hours through all our different medias. First of all, congratulations to everybody, including Dr. Rana, for initiating the QAI Technical Committee for coming out with standards for accreditation of telemedicine concept in India. I have been debating, I'm going to confine myself more to some clinical aspects. We have been debating over some time on the role of telemedicine in medical practice, because now when we talk about recovery rate, the recovery rate is going to be more than 90%. Therefore, after 9 days of an illness, the patient will come back for a normal consultation. But now telemedicine has become a routine. And one of the recommendations we have given from Confederation of Medical Association of Asia and Oceania is that every consultation now should have three components: pre face-to-face meeting, and a post face-to-face meeting. That means when a patient comes to you for a consultation, he should send you a brief like a lawyer. Lawyer gets a brief with annexures. Lawyers only read the brief and they only see the annexures if required. Therefore, now as a doctor, we would expect a patient to send us electronically his brief along with annexures. We will be able to read the brief, and based on that brief, we can ask him to get some investigations before he comes for a face-to-face meeting. When he comes for a face-to-face meeting, it will be only for less than 10 minutes. That is the time required to examine him. So once we have examined him, we ask him to go. And then second telemedicine consultation comes, where we discuss with him electronically. We prescribe, we discuss everything electronically. This is the concept we have streamlined at Confederation of Medical Association, where 19 medical associations are a part of it. So what we are suggesting is that every consultation with a medical department should have three phase, telephase, face-to-face, and a telephase. All three can be telephase, and if they all three can be, all of three of them can be a telemedicine. But if you require a personal face-to-face meeting, that should be preceded and it should be after the face-to-face meeting. Maximum interaction should be on telemedicine. A, we don't know how the virus is behaving. B, we don't know when COVID-20 will come. C, there are reports every day. Today, the virus has been detected in a skin biopsy. So therefore, we don't know whether a lesion of the skin is contagious or not. Because a study has been published in Lancet, we have demonstrated that in a patients with a maculopapular rash with RT-PCR negative, they could trace the virus only in the skin. Second, in China, 2 cases have been detected where the RT-PCR has been found positive in 80-year-old female after 6 months and in another person after 4 months. Therefore, as on today, we don't know how this virus is going to behave. Therefore, telemedicine is going to be an essential component of every practice. There were people who were thinking that maybe after COVID is over, normal practice will come back. So I personally feel it will not come back. I personally feel that the post face-to-face consultation again will be divided into 2 parts. One will be a prescription part, and the second will be a general guidance part. And that general guidance part will be like a Zoom meeting we are having now. So that means if I have seen 25 patients, I will give them a 5 minutes post-consultation prescription, then ask them to come back in a joint meeting on Zoom or any other platform, say 6 o'clock in the evening. Then all my patients together, I do counseling instead of doing one-to-one counseling. That would save time. Everybody will be able to listen. So everybody will get 1 hour of time. If I have 60 patients, all of them will go 1 hour instead of getting 1 minute each. So that is going to be the future. And that's what have been recommended by Confederation of Medical Association of Asia and Oceania, which I feel is parallel to what Dr. Rana has initiated under QAI for bringing out the standards. Now the standards are required with the digital health mission. With the digital health mission, the only thing is required is your privacy, and your privacy is very, very, very important, confidentiality and privacy, and for which some standards are required, for which some regulations are required. Therefore, there was a need of such a regulation and accreditation with which patients will feel that their data is safe, their privacy is safe, and their confidentiality is safe. With this, I hand it over back to Dr. Rana, congratulating him that this is a wonderful initiation which now is being launched today, and none other than by Dr. M.C. Mishra.
Thank you so much, sir. Thank you very much for your wise advice and words of wisdom, particularly related to the clinical aspects. And it's not me, it's all of you who have responsible for taking it to this level. So thank you all. With this, now I move to the next stage of putting a small presentation to you all. I'm just sharing my screen with you all to show you brief about QAI. Just give me a moment, please. So this is today we are on 15th of August 2020, a very historical day for India, being a 74th Independence Day. We are aiming to launch accreditation standards for telehealth, though virtually, but it gives us complete sense that we are meeting face to face, even better than that. We started as an accreditation body in August 2017. It's close to almost 3 years of starting operating, and it has become one of the fastest evolving accreditation body around the world. In last 3 years, what we could develop in terms of accreditation standards and program, I think no other accreditation body could have developed in these 3 years. We have a vision set for ourselves to nurture the largest global pool of organizations and people through quality improvement and accreditation framework. And to achieve the vision, we have set the mission for ourselves that to conceive and deliver education, training, accreditation, and related programs in partnership with the stakeholders using an approach of co-design and co-creation. In last 3 years, we have achieved a lot, but most importantly, what we have in terms of developing accreditation or certification standards are as follows. We started with developing the first set of standards for assisted reproductive technology, commonly known as ART centers or IVF centers, which is a need of the hour because a lot of infertile couple are looking for a treatment, and it's very important to provide a quality care, safe care, as well as maintaining their privacy and confidentiality. Then we opened for home healthcare accreditation program, which has come out. The technical committee has come out with these standards 2 years ago. And this program, when we started, people were literally laughing at us that what are you doing? What about you home care? Who would be subscribing to home care services? But now COVID-19 has proved them all, you know, wrong. That talk of the day and talk of individual. Even national or international organizations like WHO are also talking about home health care. And as we all know, that we already have moved to providing home health care for positive patients who have been quarantined at home. Then we started for dialysis centers, another specialized service. And I think clinically, if we look at the clinical services in a hospital, I think dialysis was one of the service which was operated around the clock, despite other facilities and services were kept on hold. Then we came out with the Green Healthcare Facility Certification Program, which are aiming to minimize the environmental bad environmental impacts and make hospital less harmful for the patient and the staff they are in the building of. Then healthcare certification program, WHO patient safety friendly hospital standard certification program, which we have adopted from WHO EMRO. Primary care clinic program is launched aiming that the primary care is the key, and to achieve primary care need to be strengthened in terms of quality and safety. It is emphasized already by WHO that a lot of medical errors happening in primary care, so it is important to have a program for primary care. Then we came out with ambulatory care facility, which comprise of different types of several include dental, eye, imaging, physio center, daycare, surgery center, blood bank, and similarly other ambulatory types of services. Then we launch on 2nd of July a recognition program for telemedicine for registered medical practitioners and Ayurveda practitioners and homeopathy practitioners at all, so that those practitioners can be confident in adopting telemedicine practice guidelines and provide a good care to their patients. And now we are sitting on the day of 15th of August to launch the latest program for telehealth accreditation. QI is the first and only accreditation body in India at the moment, achieving two standards accredited by ISCO External Evaluation Association. Last year in June, we achieved ISCO accreditation for our dialysis standards. And this year in February, we achieved accreditation from ISCO for our home healthcare accreditation program, meaning that these standards are internationally recognized and acceptable, making QI not only body functioning at par with anywhere in the world. We are institutional member of International Society for Quality in Healthcare, ISQA, making us sitting on different committees and also having a networking opportunity with different people around the world and organization working in the same field. We are happy to announce that just last month we have been accepted as an institutional member of International Society for Telemedicine and E-Health, which is an international organization driving the work on telemedicine and e-health. And I think this is what we are looking forward to work with ISfTeH in moving forward. We also run a journal, QI Journal for Healthcare Quality and Patient Safety, to disseminate information and research led by different individuals and organizations in the field of quality and patient safety. Today, we are launching accreditation program for telehealth. I just want to give you a feel of it. We would like to thank the committee member, the technical committee members who have been drafting these standards for last couple of months, which is chaired by Dr. K.K. Aggarwal, who is just delivered his opening remarks. He is the president of CMAAO and president of Healthcare Foundation of India and former national president of IMA. Another members include Professor Dr. K. Ganpati, a director of Apollo Telemedicine Networking Foundation and director of Apollo Telehealth Services and past president of Telemedicine Society of India. Colonel Dr. Ashwini Goyal, founder, member, and president-elect of Telemedicine Society of India, an external assessor and expert and senior consultant for QA and QI for NQAS NHRC Ministry of Health and Family Welfare. Dr. Bra, who is the Chief Operating Officer of Healthcare at Home India Private Limited, and also he chair a QI Technical Committee for Healthcare Accreditation Program. Mr. Saurabh Kochar, he is the founder and CEO of Meadow Healthcare, and he is a serial entrepreneur in healthcare services. Dr. Suptendra Nath Sarbadikari, founding project director for Center for Health Informatics in Ministry of Health and Family Welfare, Government of India, and WHO expert on digital health. Mr. Nilesh Jain, he is director of Clean Advantage Healthcare in USA, and he is also serial entrepreneur in healthcare business. Ms. Deepika Grandi, she is the Business Development Head India for Cleveland Clinic and also Director of IMAS Healthcare Private Limited. So these were 8 people who are actually contributed in developing these standards. So on behalf of the board of QI-CHSE, I really want to thank them and commend them their work, which has fruition come to today. So framework of accreditation standards, briefly to give an idea, the framework based on different literatures and materials and the knowledge base existed. So it's primarily based on some of the requirements of telemedicine practice guidelines, which are relevant for telemedicine and telehealth practices, which were released by Medical Council, Board of Governors in supersession of Medical Council of India, Central Council of Homeopathy, and Central Council of Indian Medicine. This has also taken information and relevant material from National Digital Health Blueprint, which was published by Ministry of Health and Family Welfare. References for source multiple WHO recommendations on digital interventions, accreditation bodies from abroad like URAC, USA, Accreditation Canada, and also from QI accreditation standards from different fields, which we have developed in last couple of years. Continuing with the framework comprises of 10 chapters in entire standards, and these chapters have been divided into different standards, and those standards have been divided into a number of criteria, and these criteria are the measurable elements. So in all, there are standards and 135 measurable criteria. So look at the structure. It is starting from the governance and leadership, which means how the organization is governed, how the management is structured to lead the organization in its activities. Then human resource management talks about the qualification and experience of human resources, which would be working in a telehealth facility. Facility and risk management is around the physical infrastructure as well as how the risks are assessed, potential risks are assessed, minimized, and taken care of. The information management system, one of the most important in telemedicine and telehealth, that how information is collected, stored, retrieved, and disseminated, all those aspects, and also maintaining privacy and confidentiality and security of information and data. Continual quality improvement is a chapter which is actually the driving chapter for continual improvement, in which the organizations need to define performance indicators and then measure them to see where they are. Patient assessment and care. Now the clinical standards are these are the clinical standards, like how the patient is assessed when he or she approach for technical consult, and then what are the things which are recorded and follow-up care is provided. And again, important aspect of patient rights and education. Rights need to be respected. It's like same as the patient is coming to a doctor in a face-to-face consultation. And also education plays a role, particularly in this COVID-19 times, that how the doctor can educate the patients for prevention and control of different diseases. Then medication prescriptions and safety. Then during the consultation, if need to be prescribing medication, what should be the rules follows, and telepractice guidelines requirements need to be adhered to, and accordingly they are put into these standards. Hygiene and infection control, and particularly in this COVID-19 times, if telehealth facility based in a hospital, and then how the infection and hygiene part is taken care of. Then digital health application would revolve around different health applications, including taken requirement from National Digital Health Blueprint, which asks for patient safety devices and how the safety of patient is using of medical device, and also confidentiality, privacy, and some other important aspects. So this is overall framework for the accreditation standards which have been formed. This is the brief process for accreditation based on a very strong foundation of self-assessment, wherein the facility would self-assess against these set of standards and then apply, which would be reviewed on desktop by looking at all the self-assessment criteria as well as the documents provided to give an idea that how they have prepared the documentation, and then also for implementation aspects. So this is what we're going to be the virtual assessment, where a desktop assessment for the documents would be done, and then a virtual assessment by the trained assessors would be carried out, resulting into a report which would be discussed in the accreditation committee, and a decision for accreditation would be made for that facility. So the important question is why a telehealth provider should sign up. So there are a lot of benefits which try to compile some of them. It enables the facility in demonstrating commitment to quality and safe patient care. It assures community about the quality of services provided by the telehealth provider. Rights of patients are respected and protected. This is an additional assurance for patients. It demonstrates transparency in practice, demonstrates that facility function in an ethical manner, ensures compliance to the prescribed telemedicine practice guidelines brought out by the Government of India, a mechanism to ensure ease of storage and retrieval of patient information whenever needed, a potential mechanism to safeguard a registered medical practitioner as well as facility providing teleconsultation from potential legal liabilities. Accreditation process stimulates continual improvement environment, and more importantly, it brings a mechanism of self-regulation. And most importantly, is a step forward supporting our national digital health mission, which is launched by our Honorable Prime Minister, Mr. Modi, today in the morning in his speech on Independence, 74th Independence Day. With this, I thank you once again for your patience hearing. And with this, we move on to our next agenda, which is a special address by Professor S. Yunkap Kwankam. He is Executive Director of International Society for Telemedicine and eHealth, Switzerland. With this, I welcome Professor Yunkap. And briefly, I would like to take this opportunity to introduce him. Professor Yunkap is the Executive Director of ISfTeH, as I just mentioned. He is a world-renowned expert on digital health. He holds a PhD in electrical engineering and was elected to several American honor associations. He is currently CEO of Global eHealth Consultants, a Geneva-based consultancy, which has developed national digital health policies and strategies for several countries and international organizations. He serves or has served on several digital health advisory bodies, including Global Alliance for Health and Social Compact Advisory Board, World Economic Forum's Global Agenda, Council on Digital Health, Innovation Working Committee Task Force, Global Knowledge Common for ME Health, and International Council for Nurses eHealth Strategy Advisory Group, including African Development Bank Health Award Committee, co-chair, WHO PMCH Advisory Group on ICT for Health, and Satellite Board of Directors. As founding eHealth coordinator at World Health Organization headquartered in Geneva from 2008 to 2008, he was responsible for overall coordination of eHealth across the organization and executive head of Global Observatory for eHealth. Before joining WHO in 2001, he was professor and director, Center for Health Technology, University of Yaoundé, Cameroon. He also served as consultant to WHO, ITU, UNIDO, the World Bank, and the US National Library of Medicine. With huge applause from all of us, I pleasantly welcome Professor Yunkap for your special address. Over to you, sir. Thank you very much. You are muted, sir.
I always seem to forget the muting or the
Thank you.
unmuting. Thank you, Dr. Rana. I hope that lengthy and very kind introduction isn't counted as part of my 5 minutes. So anyway, it's good
Not at all.
to
Not at all.
it's good to be here with you. It's an honor and a privilege for me to speak to all of you today on this very august launch of the QAI standards for telehealth. And I'm happy to see the International Society for Telemedicine and eHealth, our family, ably represented. We have the current ISfTeH board member and immediate past president of the Telemedicine Society of India, Mr. Vimal Waklu, current president of the TSI, Major General Dr. A.K. Singh is supposed to be with us. I think he is. Past president of the TSI, Professor Dr. Krishnan Ganapathy, my good friend, and others, other speakers who are members of the TSI. This brings back to me memories from Bangalore in 2005, when we played a midwife role to the birth of the first TSI executive at ISRO. Chairman Nair had welcomed us to an excellent conference organized by A.K. Sangal and L.S. Satyamurthy, with experts from relevant government departments, such as B.S. Bedi, who is currently COO of TSI. On that occasion, we bore witness to the election of pioneers, such as Professor Dr. Saroj Mishra and Dr. Krishnan Ganapathy, under the presidency of Dr. Bandrina. 13 years later, in May 2018, precisely on the 25th of May, digital health was propelled into high gear. A tweet from the Indian Union Minister Jagat Prakash Nada read, and I quote, "I am happy to share that the landmark resolution on #digital health initiated by India was unanimously adopted by the 71st World Health Assembly in Geneva. India received widespread praise for its leadership on this forward-looking agenda, #WHA 71, end of quote. That was the birth announcement of resolution WHA 71.7. It followed two earlier resolutions of the World Health Assembly. In 2005, resolution 5828 on e-health outlined the major benefits for bringing the power of information and communication technology to bear on health challenges. I was at WHO at the time, responsible for e-health. Since we could not do everything, we were asked to identify key aspects of the work that WHO could undertake, which would serve as a catalyst for all the e-health activities in countries. So in January 2006, the World Health Organization's Executive Board, the second highest organ of the organization, approved what we term the WHO e-health priority action areas, consisting of 4 applications, namely workforce development, access to information, health information for the public, and service delivery, accompanied by 4 enabling actions: policy and the regulatory environment, public-private partnerships for ICT R&D for health, developing the business intelligence about digital health, and of course, norms and standards and interoperability. And so quite logically, the next major World Health Assembly resolution in this space was resolution 6624 on standards and interoperability, passed in May 2013. So that's some of the background on where we are today about the area of standards and interoperability as a whole, which of course is a prelude and important aspect to accreditation. So I would like to mention that we're now bearing witness to the launch of the QAI standards, 61 standards with 239 criteria as you've just heard from Dr. Rana, grouped into 10 chapters. Now, this is a remarkable feat to boil down the complexities of the digital health landscape with its multiplicity of disciplines into, a crisp and concise package like you have in these standards. We trust that the work has looked at the big picture in a new way, where we can see both the forest and the trees, so that we can better understand the salient aspects of the standards, their higher purpose, the broader health system and economic context, nationally, globally, in space, what is being done where, in time, what has gone before, what is coming next, as well as collaboration, what can be shared, what can be leveraged. We trust that you have taken into account consideration of the scope of digital health, which encompasses 3 circles of engagement: the patient circle, the professional circle, and the organizational context. We further trust that the work will contribute to the meeting the key objectives of the World Health Organization's global strategy on digital health, which are to promote global collaboration and advance the transfer of knowledge in digital health, to advance the implementation of national digital health strategies, to strengthen governance for digital health at the global, regional, and national levels, and to advocate people-centered health systems that are enabled by digital health. Finally, we trust that the work is consistent with the WHO classification of digital health interventions, which fall into 4 broad categories, namely clients, providers, managers, and data. We recognize that development of standards is an ongoing activity. You've said as much, Dr. Rana, and that the written standards are a living document. I would therefore like to close my remarks by making an offer and a challenge to QAI. First, the offer. It's one of collaboration with the International Society of Telemedicine and eHealth, of which QAI is an institutional member, as you mentioned. Our work in the society on standards and accreditation has evolved to where we currently have both a board committee and a working group focused on this topic. This collaboration will eliminate duplication of effort and leverage the efforts of other key players in this space. I can assure you that whatever challenges you may face in the area of norms and standards and accreditation are not unique. They have probably been experienced, even successfully addressed by someone else somewhere. We can therefore make norms and standards and accreditation a dimension of the society's global knowledge commons. This will track who is doing what, where, how well is it working, what can we learn from it, and what can we use and reuse from it in the area of accreditation of digital health. And now for the challenge. At the next QAI launch, let's ensure that every speaker has the affiliation member of the Telemedicine Society of India. There is a proverb which we Africans like to claim as ours, although its logic is quite universally applied. It says, if you want to go fast, go alone. And if you want to go far, go together. So I urge you, as part of this challenge, that we get people to join the TSI so that together we can reach the stars in the area of norms and standards and accreditation of digital health. Thank you for your attention.
Thank you, sir. Thank you, Professor Yunka, for your wondrous. And I think we have got several messages, loud learnings, advices. And I think the great thing which you have said, the collaboration with ISfTeH and the challenges which you have thrown on us to get more members for more collaboration, more networking. And I think in time to come, we would try to meet both of these opportunities, the collaboration as well as the challenges. So we look forward to working with the society and with you and all other members in making life of our patient easier. So what the agenda of each one of us is, that how we can meet the requirements and the demands of the patient, whether it's a normal condition or it's a pandemic like COVID-19. So thank you, sir. Thank you very, very much for your words of wisdom. We are really grateful for your time and support which you have extended to us to be here. Thank you. Now I would like to invite our next dignitaries, Mr. Vimal Baklu, and again a luminary, is a former chairman and managing director of Telecommunication Consultant India Limited, a Government of India enterprises. Is a board member of International Society for Telemedicine and E-Health based in Switzerland. Is a former president of Telemedicine Society of India, and he has credible things to his credit. And one of the most important things which I would like to definitely read is that he has been instrumental in the successful implementation of the prestigious Government of India's Pan Africa E-Network project, a project which was envisaged by our late President Dr. APJ Abdul Kalam, and who has was visionary in bringing nations together. And this project could bring 48 nations in Africa to India for education and health services. And Dr. and Vimal Vaklu has several other membership of national and international organization. And if I keep reading, and I think it's more than 2 pages. So I would like to take this opportunity to welcome Mr. Vaklu, sir, and request him for his special remark. Over to you, sir. Thank you.
Thank you, Mr. Rana. Actually, good morning to Mr. Yunka, and good afternoon, everybody. It's a pleasure being a part of this forum today. Actually, Dr. Aggarwal mentioned about 3 components, 3 phases of patient handling. I mean, of course, there is a little challenge I would like to mention here, that India and many other developing nations, they are on a different footing altogether. Like, I'll start with India. It's a country of 1.35 billion people and 6.5 lakh, 650,000 villages, and about 1 billion people live over there. Now, the challenge is that we have only about 250,000 doctors in the country. Rest find greener pastures. And with 250,000 doctors, at least in the near future, there is no possibility of having 1 doctor in each village. So, physical contact is a luxury here. So the only way out is e-health or digital health. Of course, we understand that once we start the telemedicine, there have to be proper guidelines, proper undertakings. And we have been lucky that after a lot of deliberations, finally, Government of India has come with telemedicine guidelines. And for that, of course, we must thank many people, and I'll come to that, who's to be thanked the most. And these guidelines, of course, provides a roadmap and guidelines for all the medical professionals. But at the same time, accreditation and certification is a must if we want to serve the customers, serve the patients well. And that is where the role of organizations like QAI comes into play. And besides this, as was mentioned earlier, the Prime Minister of India has announced the National Digital Health Mission as well. Now, with this, we enter a domain of complete, digitization of health services in the country. There, we had deliberations when the blueprint was being prepared from the Telemedicine Society of India. And of course, we feel that there are many miles to go in this direction. And since artificial intelligence, AR, VR, 3D printing, e-networks, and also now, I feel digital twin of a human being also would be one of the things that might happen, which will help people sort of experiment with the twin part, not the human being part. That's where accreditation becomes all the more important. We need to ensure that technology does not harm the patient in any way. I mean, in the name of technology, people should not get away with negligence. So all these things need to be taken care. And of course, I mentioned that there are a number of reasons why we got this guideline in sometime in March beginning, and one of the things we need to thank is COVID. Because of that, the government of India had to fast track this and finally came up with this guideline. And the best part is that apart from the conventional medicine or the allopathic medicine, we call it, they also issued guidelines for Ayush. That was a big step forward. But I thought maybe things were going slow only in India. But last month we had a webinar. It was a MENA webinar, and I participated in that and came to know from URAC people that in US also, there was 800% increase in the uptake of telemedicine after the COVID-19 struck United States. So I think we in India are not alone. There are challenges elsewhere as well. I mean, now people have started taking things seriously, and that's what I feel is important. Besides this, I would like also to mention that, QAI, of course, they have started accreditation just 3 years back, but I would like to narrate an experience I had about a decade back with them when they were doing, sort of certification programs for PMI. And it's a coincidence that in ISfTeH, I have been advocating that. I was not aware that QAI also is doing accreditation job. So I suggested some of the good practices which PMI did here as well. Now coming back to QAI, I was approached to deliver a lecture on Pan-African e-network. So I told them, okay, I'm ready. I'll do it. My presentation is ready. You tell me the time, I'll come. Then the gentleman there, I've forgotten his name. He told me, sorry, sir, it should be from project management perspective. So I realized, because I'm a certified project management professional, that it involves about more than 4 dozen processes. So I sat down on a weekend and completed that. But when finally the presentation happened the next day, on a Monday, I realized I had learned a lot in the process. I mean, that gives me assurance that the quality is something that QI really sort of values. And I'm sure that this particular association, which ISfTeH would have with QI from the accreditation and certification perspective, will be very effective. Thank you very much.
Thank you, Vimal sir. Thank you very much for your kind words and the words of wisdom. And I think a lot of message we have received, and some of them are really, critical for the success. I forward to your support and definitely again the working with the ISfTeH. Thank you, sir. Thank you very much. With this, now I invite Major General Dr. A.K. Singh. He is the president of Telemedicine Society of India to deliver his remarks.
Thank you, Doctor. Sir. Thank you very much. And Professor Yangtup, it's a pleasure to see you and hear you, and all the dignitaries, Dr. K.K. Aggarwal and all. It's been great. Dr. Mishra is around. That's good. Now, there are a few things which I would like to say. Number one is the technical committee has a lot of TSI members. And what Dr. Yangtup has said is all of you in the QI should become TSI members. If you are not, please enroll yourself and become TSI members. That is one. The second thing that I like to say is you brought out a very comprehensive guide, accreditation booklet that is there. It's about huge. There are 239 criteria that you are looking at. Please make some handout for small people, because I've been following. I'm a very ground worker. I've been to villages. I love to be in a village. And what I've seen is the health ecosystem in a village is totally different from what we are advocating. There is a Jhola Chap doctor, there's everyone there. So with that in mind, you have to have a lot of IEC going on. You got to have a lot of information, education, communication, and the most difficult part of a project is the implementation. How are you going to implement it? I have about 6 as the TSI president. From the last 25th of March, we have had about 8 or 9 people who have gone to the villages who are service providers, and they are looking into it. And it's a huge challenge in the village. The Jhola Chap doctor is there, the people are there. So it requires a lot of things. So the accreditation process should be spanned over at least 8 to 9 years. Don't be in a hurry to implement it. Don't disrupt what has already been disrupted. What is today is fantastic. We are now very happy that telemedicine is reaching the far and out. I come from a very small village in Churu district. I'm 22 kilometers from the the nearest hospital. And what we would now like to do is, let's go local. As the Prime Minister says, local is vocal. Unless we hit these small towns where the doctors are there and convince them that telemedicine for their rural clinic, rural people is a must, it will be something fantastic. I am really thankful to the TSI members who have contributed, Dr. Ganpati, Ashwani Goel, Vimal Vaklu, and a lot of others who have interacted with. So it's thank you very much. And I think it's a good challenge that you have brought up. Please take out small handbooks, as in a lot of dialects that you require. You'll require it in Hindi, you'll require it in other languages, and we'd love to have it. And I'm sure without TSI collaboration, you will not be able to move. You can do that. I'd love to invite you all. We are in the process of signing an MOU with you. And thank you very much. It's a lovely event. Thank you.
Thank you, sir. Thank you very much for your words of wisdom. And I already taking note of several of your messages. And sir, it's not QAI, it's everyone has to come together. And you rightly said the implementation is the most difficult part of any standards, whether it's mandatory. So that is why we are entering into MO with TSI, and also we work with other organizations, how we can spread, working together is the key. It's not, the standards are not meant for QI as organization. These organizations are meant for others to use, and definitely we'll reach out to the far places where the need is more than the urban areas where the facilities are already in advanced stages. So well taken message, sir. We would definitely collaborate with like-minded organizations and individuals, so that we can definitely move forward. And at QI, personally, myself, and all the members associated with us, they love taking challenges. We like to do different things differently. We don't like to work what people are already doing. So we would definitely, challenge the situation for the best outcome, which we can all together can achieve. So we will move forward together. So thank you very much, sir. Now with this, I would like to invite Professor Dr. K. Ganpati, who is our very senior member of a technical committee and in the director of Apollo Telemedicine Networking Foundation, and of course, Vice President of Telemedicine. Over to you, sir, for your remarks.
Good afternoon, everybody. Thank you, Dr. Rana. A couple of months ago, when Dr. Rana first approached me and spoke about quality and telemedicine, I realized that quality is never, ever an accident. And that one thing which worried me was the last 20 years, some of us have spent in trying to evangelize telemedicine. When we started telemedicine, that word was a dirty word. It took 20 years before people understood what it is. But thanks to a strand of RNA measuring just less than 120 nanometers in size, which is now acting as a global CTO, Chief Transformation Officer. Today, telehealth is known across the length and breadth, not only of India, but of most countries in the world. I was just thinking to myself, the only difference between Bill Gates, Mukesh Ambani, and Ganapati is the fact that there are 8 zeros more in their bank account than in my bank account. So it's all just a question of numbers. Unfortunately, in the world today, everybody, a cardiac surgeon is considered fantastic if he has done 20,000 open heart surgeries. A cardiac surgeon who has done 50 open heart surgeries, no patient will go to him. In the process of increasing membership of TSI, for example, so in the process of getting more and more and more numbers, there is a real danger and a risk that we sacrifice quality. And I think we need people like the QAI. Let me be very honest, I never thought of quality as such. I spent all my effort and energy in trying to popularize telemedicine. But now I realize that quality means doing it right, the right time, all the time. In a utopia, in an ideal world, quality should be when Big Brother is not watching you at all. Unfortunately, it was going to take us several years before we reach that stage. And I think it's very, very important that we have a dedicated, committed, passionate group like what my little association with QAI seems to suggest, that this is the group there. And I think quality has now become a subspecialty. It's impossible that a medical doctor or even a so-called telemedicine specialist can also concentrate on quality. I think it's very essential that people who are trained, like Vimal Vaklu mentioned, project management. So like that, I think accreditation, quality, etc. are subspecialties. The starting point of all achievement is passion, commitment, desire, and I think QAI seems to have it. Again, we should remember that if a thing is worth doing, it is worth doing well. 85%, 80 to 85% of failure in any process, be it medical, be it surgical, whatever it is not the mistake of the person who's actually doing it, but simply because there is no SOP. When I was a medical student, when I was a professor of neurosurgery in the Madras Medical College 30 years ago, the word SOP did not exist. Today, we talk about audits everywhere. One of the successes for corporate hospitals is because they have SOPs for everything. You know, it's unbelievable the number of SOPs which they have. I'm very happy to be associated, to be part of QAI, and I really hope that you as a group of people, as specialists, concentrate on the quality part of it while we continue to concentrate on trying to bring remote healthcare. I think we require a specialized group. Perhaps the president of TSI will even consider forming a small subcommittee of people who will be entrusted with the job of ensuring quality while others ensure quantity. I could go on talking and talking, but I see you are looking at the watch already. Thank you very much for giving me this opportunity.
Thank you so much, Ganpati sir. He always wonderful to hear you, and listen for hours together. Thank you very, very much. And I think we are definitely making the note of all the suggestions coming up for the improvement. So thank you very much, sir. Now I am moving on to invite Colonel Dr. Ashwin Goel, who is again QAI founder, member, and president-elect of Telemedicine Society of India. Over to you, sir.
Thank you, Dr. Rana. Good afternoon to all the luminaries who are today a part of this momentous occasion. Dr. MC Mishra, and I welcome Professor Quancom, who has a very long and intimate relationship with the Telemedicine Society of India. I bring you all greetings from the Telemedicine Society of India. One piece of information which possibly you may not be aware, that Telemedicine Society of India is also the national member of the International Society for Telemedicine and E-Health. The TSI represents India as far as the ISfTeH is concerned. And TSI and ISfTeH have a very long history of association and very gainful fruitful association, if I may say. Coming back to the launch per se, it is a seminal day indeed today, as the Telehealth Accreditation Standards, the first edition, are being launched by the Quality and Accreditation Institute. A very big cheer for the members of the technical committee for accomplishing the job on a fast track within a span of almost 3 months, in fact, even less than 3 months, to be precise. The launch of telehealth standards on the 74th Independence Day is actually a very liberating moment for telehealth, which is well on the way to being the new normal for delivery of healthcare services, not only in India, but globally. And as Dr. K.K. Aggarwal mentioned earlier in his talk, it is going to be an integral part of the clinical processes of all clinicians in the days to come. The sudden rapid proliferation of telemedicine companies and their array of products and services, it necessitates a national standardized means of assuring quality, patient safety, and competent care. Until now, the telemedicine industry has not had an easy to identify confirmation or seal of approval of quality from an independent third-party organization. So in this case, accreditation will also help to fill the regulatory gaps that occur when the pace of innovation moves faster than the regulations can keep up, as is evident with telemedicine, and we all know it so very well. The accredited organizations will be able to demonstrate to their various stakeholders that the processes and procedures promote better clinical and financial outcomes, including patient safety. In addition to having the right seal of approval, which is a differentiator in a crowded field, an accredited organization should be able to capture increased market share because they have the stamp of approval from a body which is giving the accreditation and which has got the stamp of approval by itself from many other global bodies. As has been mentioned earlier, the standards have been a result of synergy between the Telemedicine Society of India, which is the pioneer of telehealth in India, whose members constitute a significant part of the technical committee, and the QI. I wish to compliment and congratulate all who have been associated with this path-breaking and onerous effort. And as the president-elect of the society and the next president-to-be, I exhort all of you who are attending this webinar to become intimately associated with the Telemedicine Society of India, strengthen our hands in progressing this technology and this way of delivery of healthcare to the masses in the very near future. Jai Hind.
Thank you so much, Ashwanishwar. Thank you very much for your words of wisdom, and I think a couple of very critical and important points which we have taken a note of. Moving forward, I invite Dr. Kal. He's again a QI Technical Committee member for Telehealth, and he's the chair of Technical Committee for our Home Healthcare Accreditation Program, and he's the COO of Healthcare at Home India Private Limited. Over to you, Gaurav.
Thank you, Dr. Rana. After such senior people speaking, I don't think I have anything left to speak, but I would say that yes, definitely this is a landmark moment, and whatever quality and accreditation we are bringing into India, I think that should lead to quality and better patient outcomes. So all the best to everyone, and I hope that more and more organizations adopt this. Thank you so much.
Thank you, Gaurav, for your crisp and very sharp words and for appreciation. And I think you are one of the person who has been, in the forefront of developing these standards. Now, I would like to invite Dr. Supten Nath Sarvadhikari, a QITC member, and has been an expert in, in the government of India for developing a full process of health informatics, and he's currently a digital health expert with WHO as well. So over to you, Professor.
Thank you, Dr. Rana. It's really been great. Today is an auspicious day, our Independence Day. The Honorable Prime Minister formally launched the National Digital Health Mission, and so QAI has come up with the digital telehealth standards on this very day. So I think it's a great achievement for all of us. And I'm certain that all of you, those who are practicing digital health or telehealth, are definitely going to come in for accreditation and standards. And of course, I think many of the speakers earlier stressed about that we need to have a community of movement. And I think that's what we are building and we'd go on building. Those of you who are not looking at the chat box, Dr. Sunil Shroff is actually actively exchanging a lot of ideas with all the other members. And I think all of us need to network in our own ways to make this grow further. I have done the sharing of the live session going on through my social media contacts already. So I think a lot of things are happening. We need to catch up with it. Yeah, it's a global trend. The COVID-19 pandemic has brought in the digital disruption that was very essential. All said and done, implementation is definitely the key word, and all of us need to work together to make it happen. Jai Hind.
Jai Hind. Thank you, Professor SupTen, for your kind words. Appreciate all your help and support. Now, I would like to invite Mr. Nilesh Jain. He is again a technical member of QI Telehealth Standards and Director of Clean Advantage Healthcare USA. And Nilesh has a very strong background of healthcare disruptions and bring out a lot of innovations. And he had just delivered a very special address on the invitation of Carnegie Mellon University in USA. One of its kind. I think this is the first time someone was invited to deliver such address to that university. With this, I would like to request Nilesh, please. Nilesh, you mute.
I always do that. Thank you, Dr. Rana. A very kind introduction, on your behalf. First of all, I really need to congratulate the QAI team. This hard work and perseverance has really paid off. I've seen the journey over the last few months of how we've actually created the standards, and so proud of this team to solve a really complex problem and transform that into a reality. And I'll tell you why this is very important for India. This standard or these standards and certifications really help ease the access of interactions that happen between providers, patients, and also the flow of data. We heard our Prime Minister speak today about the importance of how rural access needs to be created. And we've had another, prominent speaker today on the panel talk about how, we'll never be able to match up to the number of doctors that are there in the country to the actual demand in terms of the consultations that are required. So obviously, at some point, the technology has to come in and play a critical and a crucial role to do this. And I think with QAI, as we speak, the biggest challenge in the current healthcare systems, for patients and for providers is really timely access and reach. With telemedicine, this is changing fast. And, fortunate for having COVID or not having COVID, this is really surfaced as one of the most critical things for us to be successful in delivering care. And I think QAI will make a fundamental contribution to make this safe, trusting, and really help providers focus on the outcomes using quality processes, products, and reach. Right. And I think, I've been in this space for the last at least 10 years, and we've seen how providers are struggling and how patients are struggling to get the best care continuum. And I think, once again, I really want to congratulate QAI. The amount of work that has been put in the output that we're expecting is just tremendous. Congratulations again to Dr. Rana and his team. Thanks.
Thank you, Nilesh. Thank you very much for your kind words. And you have been part of this group and team, whether you like or not, you would continue to be part of this exercise in time to come, because we all together has to make it happen. So thank you very much, Nilesh. I would like to invite Ms. Deepika Gandhi. She's a TC member for Telehealth Standards and Business Development, Head of India for Cleveland Clinic USA, and Director IMAS Healthcare. Over to you, Deepika.
Thank you, Dr. Rana. It's been a pleasure and a great opportunity for me to work with so many leaders of QI and telemedicine industry of India. I'd like to leave the audience today with just 4 compelling reasons as to why not accreditation. We've been talking about why accreditation, but I think we really need to change the culture and say, okay, why not? One is obviously the patient safety. Number 2 would be avoidance of malpractice issues. As these standards allow compliance with data protection, patient privacy. Number 3 would be operations of scale and economies of scale, as Dr. Aggarwal pointed out, efficient physician time management without compromising patient safety and outcomes. And last but not the least, as the business head of the world's number 2 ranked hospital in the world, I would say when foreign institutions are looking to partner with Indian organizations, it gives immense confidence and trust when we are working with organizations that have these accreditation standards built in. So with that, I want to congratulate the team. Happy Independence Day. And as Dr. Yukon pointed out, let's embrace digital health together. Thank you.
Thank you, Deepika. Thank you very much for giving an assuring and giving reassurance for the development which took place in last couple of months, and how we see the collaboration and networking as a strength for moving forward. So thank you very much, Deepika. With this, before I ask our chairman for the launch address, I would request Professor Tupil Venkatesh, he is one of the board member of QI, to just say a few words, please. Over to you, Dr. Venkatesh. You are mute.
Thank you, Dr. Rana. I am honored to be with luminaries in the healthcare. I am extremely delighted to be with all of you. I tell you, when today morning, when I was listening to our Honorable Prime Minister, he was talking about reaching out to all Grama Panchayats through fiber optics. Now, communication system is on a priority at the national level. Now, with 275,000 Grama Panchayats, almost equal number of primary healthcare centers, where over 80% of our poor population reaches them, and they are the beneficiaries. Number one, today is a great day. Number two, a great event has taken place by QAI when Dr. Aggarwal has released this standard. Third one, I tell you, the poorest of the poor of this country will be benefited enormously. And it is telemedicine is the safe health, speedy health, healthcare. In fact, with this telemedicine blended with home care will reduce the cost, unnecessary cost on travel, unnecessary cost on time wastage, and people can remain at their places and continue to work and be productive. The country develops economically, commercially. Any country which adopts telemedicine and home care will be the most economically most efficient country, which you have been promoting. I compliment QAI, compliment all the members of QAI for initiating this, which was long awaited. And I'm sure with this fiber optics going to every corner of our country, communication system will be enormous. There will be excellent support. This is what we are dreaming. At the age of 73, you don't know how much I'm a pre-independence man. I am a pre-independence man. How much I am delighted to see this happening post-independence. I had to wait for 73 years, 74 years. It has happened. Rana, congratulations to you. And I'm sure this will be taken up by everybody, and everybody will be benefited. And within next 4 or 5 years, we will see the healthcare system getting strengthened in our country with this implementing the standard for accreditation. Thank you very much.
Thank you, sir. Thank you very much for your the words of wisdom, and we really appreciate your support and kind words, which make us elevated to move forward. Thank you very much. With this, now I would now come to Professor Dr. M.C. Mishra, who is our chairman and director of India Institute of Medical Science, New Delhi, and currently the president of Mahatma Gandhi University of Medical Sciences. And Dr. Mishra has been pioneer in promoting the clinical care, its efficacy and effectiveness, bringing out a lot of innovations in how the healthcare can be improved, the clinical care of the patients can be improved by reducing medical errors. So he has been a pioneer in healthcare, but now he is associated with QI as well and guiding us on how we can improve quality in clinical care per se. So with these words, I am honored to invite Professor Mishra for his launch address, please. Over to you, sir. Thank you.
Thank you, Dr. Rana, and congratulations. I must put on record upfront the efforts delivered by under the leadership of Professor K.K. Aggarwal, the technical committee, who worked very hard and came up with these guidelines on telemedicine for India. And I am sure these guidelines would be very handy for any geographic boundary which decides to adopt these guidelines and modify according to their needs and implementation. Telemedicine, we have been as a student hearing for a long time, more than 3-4 decades. And initially when we were students, it was for far-flung areas in Australia, in US and other places. But it never made much headway. We all know that there is a huge telemedicine facility at Sanjay Gandhi Postgraduate Institute of Medical Education and Research, Lucknow. It was by the efforts of Dr. S.K. Mishra, who brought this facility up, but that was used more for tele-education, tele-mentoring, and also for surgical education in some form, but not as a telemedicine per se. Then what we saw in recent past when at All India Institute, we tried to digitize our medical records. We tried to digitize patient appointment systems. We also established a call center where patients could call and fix up appointments for follow-ups so that they need not to visit hospital unnecessarily, because if you see, the patients spend quite a lot of money to come to the healthcare facility for follow-ups. So that the telemedicine particularly is going to avoid altogether that. And now when I was in Jaipur for last 3 years, I saw that Mahatma Gandhi Hospital had almost 100 nodes, rural nodes connected by telemedicine to Mahatma Gandhi Hospital in last 3 years. And our consultations actually rose from 100 to begin with, and later on 600, 800 every day. I think General A.K. Singh would know that. And similarly, there have been efforts by private players in this area because it's a nascent area in India. A lot of people in Rajasthan, UP and other places have been using this network of tele-network for consultations and for follow-ups. Telemedicine Society, Dr. A.K. Singh was spearheading it, and now General Goel is spearheading this society. But for COVID, I think COVID has served as a catalyst for bringing telemedicine at the forefront today. This is something which was very much needed despite our efforts, Telemedicine Society's efforts, International Society of Telemedicine efforts. Digital technology was not used. And today, if I may say, we are using only 5% of its potential in healthcare. There is a huge potential in this area of telemedicine. And this is something which is going to go a long way, as also now it syncs with the Prime Minister's announcement of National Digital Health Mission today. And I think that is something which is going to go a long way in access to healthcare for people in far-flung areas. When it is, as was mentioned just now, that 275 panchayats, there is a high bandwidth cables have been laid down, and it can actually reach every nook and corner of the nation by connecting to primary health center, to community health center, to district hospitals, to medical colleges, so basically connectivity can serve, and not only in tele-consultation, telehealth per se has many other dimensions like tele-education. Now, if you see in lockdown, there is actually the webinars and webinars and webinars. And some people have made a lot of jokes and a lot of cartoons on webinars, that how many are taking place. And that is something, a lot of online education has begun. So there are a whole lot of dimensions of telehealth in the country. Telemedicine per se, Apollo Hospital has been using it to remote areas in Himachal Pradesh, I know that. So there have been sporadic efforts, individual efforts of the institutions, individual efforts of individuals. But with this COVID, since the physicians are reluctant to come in contact with the patients, patients are reluctant to visit the hospitals. So as Professor Aggarwal very clearly mentioned, there is a pre-face-to-face consultation by sending the reports, investigations, etc. on digital platform, on the social media platform, which is so easy today to share CT scans, MRIs, other reports on your smartphone. And then face-to-face also, whenever you don't need patient to come for physical examination, a lot of things can be actually organized. Like somebody consulted me recently for a hernia in the abdominal wall. I said, take a photograph, take a small video and send it to me. So I could have a look what is happening. And then of course, post-treatment, a lot of advice is being given today already. And by Government of India giving it a legal status, I think that has been the watershed in the telemedicine provision in India, by Board of Governors, Medical Council of India, when recognizing that teleconsultation is a legal document and one can give a prescription, scan it and send it on the social media platform to the patients. So, and then it is not only that it is limited to urban. As I mentioned, in Rajasthan, I saw the rural people getting consultation from Mahatma Gandhi Hospital through 100 notes from primary health centers, through ASHA workers and other. So it is actually now with government putting this on the forefront by digital health, National Digital Health Mission. I am sure that in coming times, telemedicine will become a very strong component of healthcare, not only during COVID times, but beyond COVID times also, because it will unnecessarily avoid visits and crowding on the hospitals, particularly the public hospitals, and even in private hospitals. If the visits can be avoided, why they should not be avoided? If the same consultation, same advice can be given by teleconsultation, why not? And you can share the pictures, you can share the imaging files, you can share other documents of reports. So it is whole lot of, and these guidelines and standards could not have come at a better time. And I must say, I must congratulate the whole technical committee, Dr. Rana, for taking this initiative ahead of time. I would say this is something he was looking beyond time, and it has come very apt. And today, 15th August, when we are launching these accreditation standards, in the morning we heard the launch of the National Digital Health Mission, now these telemedicine. So it syncs with that. I am sure Dr. Rana would share these accreditation standards with the licensing agencies like the Medical Council of India, the National Board of Examination, the Ministry of Health. I think they are all stakeholders in this whole process of access to healthcare, access to affordable healthcare. And that is what in India we are looking at. It is not only accessible, it should be affordable. And as was rightly mentioned, that home care, along with that home care, will also become very strong component of telemedicine. Because if you see the compliance of medication, it's an issue in every society, including India. In USA, the figures are that at best the compliance is 70% of the medication. So in India, one can imagine what would be the compliance of medication, and the telemedicine can really do wonders in this area also, and many other areas of telehealth, teleeducation, telemedicine, teleconsultation. We have been using it for like televideo conference, e-conferences. We have just organized on 17th and 18th July a e-conference where live surgery was shown from 5-6 centers on digital platform. So a whole lot of scope it has, and I am sure this launch is very befitting with the need, today's need and future need. It is not that after COVID this will not be needed. After COVID, I think this will become a norm, and many things can be done, like meetings today. Most of the institutions are conducting their meetings on digital platform. So I think the digital technology in day-to-day world is going to play a very major role, and saving a lot of resources, lot of unnecessary travel, and a lot of unnecessary expenses on the part of public as well as the government and other institutions. So this is something which I again congratulate, and I really thank Dr. Professor Aggarwal, KK Aggarwal, for leading this group and coming up with these accreditation standards, which will come handy for institutions as well as individuals. So thank you so much, everyone, for giving your time today from Geneva, from Switzerland, and from USA, from other places, all the technical committee members, and the president of the International Society of Telemedicine, president-elect and president of Telemedicine Society of India. I think your efforts are now bearing fruits today, what you have been envisioning for last so many years. So thank you all gentlemen again, once again, for your time and effort in this direction. Thank you.
Thank you so much, sir. Thank you. Really appreciate your words of wisdom and guidance you have been, and thank you for getting the standards approved by the board just last week, so that we could launch these standards. So, sir, thank you very much for all your support all these days. With this, I request Mr. Sir to just launch these standards. I'm screening, share the screen of the launch. This is the launch of accreditation standards for telehealth on this auspicious occasion of our Independence Day, 15th August 2020, virtually. And this is the cover page of the standard. So
we all launched together. Everybody,
yes,
34 of us are launching this today on 15th August. So you can clap for our efforts. And again, thank Dr. KK Aggarwal for giving his valuable time. I know how busy he is with his other commitments, and still he got time to give us these accreditation standards. It's a hats off to him.
Thank you so much, sir. Thank you. I think it's a lovely time. With this, we come to the end of the current session, I would say. We would continue meeting and seeking your guidance and support, because this is not the one organization or individuals can achieve. We all have to come together, and are rightly said by all of you that collaboration is the key, and that's why QI board believe in coming together and moving forward. So with this, I would like to once again thank Professor Yunkap.
This is the huge beginning.
Dr. Rana, I just couldn't miss this opportunity. This is the best birthday present I could have asked for.
Oh, wish you a very happy birthday, Professor Yunkap. And I think it's a memorable day today. I think we will not forget.
Happy birthday, Dr. Yunkap. Didn't know that.
So it's a great.
Dr. Heartiest congratulations. Many happy
Thank you.
So thank you. We would,
wonderful present.
We will remember it, and I think we will make it more official. So thank you, each one of you, for your great time and support. And we continue looking forward to your continuous support to make this happen in time to come. So standards are there, now need to be put on and practice on ground. So that is what is more challenging. Thank you very much once again. Namaskar. Jai Hind.
Most memorable day in my life.
Thank you.
Thank
Jai
you.
Hind. Thank you. Thank you. Thank you.
Everybody.